Good afternoon, everyone. My name is Sarah Rittling. I'm the Executive Director of the First 5 Years Fund, an organization dedicated to ensuring that all children from birth through age 5 have access to affordable quality care. In May, we joined with many of our friends and colleagues in this work to launch the Child Care Relief, a campaign to ensure the federal government recognizes and prioritizes the needs of child care providers and families in this COVID-19 economic recovery and beyond. Thank you so much for joining us today, albeit virtually, to talk about the critical role the childcare industry plays in our economy and the undeniable need to stabilize the industry that has been hit particularly hard by the COVID-19 economic crisis. We all have our personal stories, whether we're home today with our children, you have nieces, nephews, grandchildren, friends, colleagues. There isn't one of us who isn't witnessing firsthand the essential nature of childcare before, during, and after this pandemic. You will hear so many compelling statistics today, but just on this point, according to a recent Northeastern University survey, 13% of US parents have had to quit a job or reduce their working hours due to the lack of childcare. Parents need choices. Even before the pandemic, childcare providers were operating on razor-thin profit margins, and parents struggled to find affordable, high-quality care. The pandemic has pushed America's already strained childcare system to the brink of collapse. Nearly half of childcare providers closed completely during COVID-19, and those that remained open, 85%, are operating with less than half of their usual enrollment. Providers are also incurring added but important costs to keep children and staff safe and healthy. Thankfully, policymakers on both sides of the aisle recognize the need to stabilize the childcare industry in order for the U.S. economy to successfully recover. Just last week, House Minority Leader McCarthy penned an op-ed calling for Congress to provide relief in the upcoming relief package. Representatives DeLauro and Scott and with Senator Murray have introduced the Child Care as Essential Act. Anyway, you're going to hear from a lot of compelling individuals today from a lot of different perspectives on the importance of this work. And so I'm going to get us started. We're clearly want to mute me, so we're going to move on. I'm going to turn it over right now to Lucy Rosillo, a senior analyst at the National Association for the Education of Young Children, to talk about the eye-opening results of their latest national survey of over 5,000 child care providers. Lucy?
Thank you so much, Sarah. I am honored to speak about the challenges facing child care today. I know that, thank you again just so much. And I really am appreciative for everyone who is joining us today. And I appreciate the opportunity to share findings from the most recent survey conducted by NAEYC, the National Association for the Education of Young Children, as well as the voices of childcare providers from across the country who have taken the time to share their experiences over the course of the last 4 months. NAEYC is a professional membership organization for the early childhood field, working to promote high quality early learning for all young children birth through age 8. With more than 60,000 members and 50 affiliates, we are proud to support all who care for, educate, and work on behalf of young children. Through my role at NAEYC, I have the immense privilege of hearing on a daily basis from early childhood educators from across the country. Prior to the coronavirus pandemic, their stories were filled with appreciation for their work, alongside concerns associated with being part of an underpaid and undervalued workforce, where families were already struggling with unaffordable childcare options and insufficient and inadequate access to quality. Yet COVID-19 has exacerbated across all states and settings the challenges programs were already facing prior to the coronavirus pandemic. The desperation is palpable, and I cannot sugarcoat this. I have been working in this space for over a decade, and I have not seen devastation and loss like what is facing the childcare sector today. From the onset of the coronavirus pandemic, NAEYC has been committed to understanding the challenges and needs of childcare programs across the country. In March and April, more than 15,000 childcare providers from all 50 states The District of Columbia and Puerto Rico responded to surveys indicating that closures were rampant, enrollment was dropping, unemployment was rising, and more than half of programs would not survive without significant public investment. Federal and state supports have helped. Unfortunately, they have not helped all programs equally, and they have not yet been sufficient. The results from our last survey, conducted between June 19th and June 30th, tell us that this lack of sufficient public investment has forced childcare programs, educators, and families into a series of impossible choices and devastating consequences. 40% of programs, and this number rises to 50% of minority-owned programs, are certain they will close without the additional public assistance they need. Our deep worry is that if help doesn't come soon in order to save childcare, there will be little left of childcare to save. The current reality is that 86% of childcare programs who responded to our survey are serving fewer children now than they were prior to the pandemic. And 63% of programs across all settings expect to be operating at or below 80% of enrollment past the end of the summer. If they are correct, and they don't receive additional public support to close the gap, this means only 18% of childcare programs expect to survive longer than a year. Only 18%. Let me phrase that differently. 41 out of every 50 childcare programs expects to close within the year if they don't receive additional support so that they can continue to serve the families who need them to be open. And here's what's underlying this. Nationally, 91% of respondents indicate they are incurring additional costs for cleaning supplies. 76% say the same for personal protective equipment, and 23% say they are spending funds for necessary facility changes so they can stay open safely. While the Payment Protection Program has brought time for programs who received funding to pay staff and cover fixed costs, it has not benefited all programs equally. 72% of respondents from large childcare centers said their programs have received PPP funds, compared to 29% of small childcare centers and only 17% of family childcare homes. The data and the stories I have heard from providers across the country all make one thing clear. Childcare programs need federal support that allows them to be open and stay open safely over time. I urge members of Congress to provide desperately needed additional dedicated emergency funding to stabilize childcare so that providers can continue to educate young children, support families, and support the American economy through this crisis, the coming recovery, and beyond. Thank you so much.
Thank you, Lucy. Next, I'd like to introduce Jennifer Calvert, who's the director of Calvert's ABC Preschool and Nursery in Aberdeen, Mississippi. Thank you for being here, Jennifer.
Thanks, Jennifer. Go ahead.
Thank you, Sarah. I'm honored to speak about the challenges facing childcare today. For 29 years, I have run Calvert's ABC Preschool and Nursery, a nonprofit childcare center located in Aberdeen, Mississippi. My program is one of only 3 childcare programs in our very rural town. Most of our families work in manufacturers, plants, home health care services, and nursing homes. They have come to rely on us to provide care and education to their children from 6 o'clock in the morning to 5:30 in the afternoon. My program is based on the principle that all children shall receive the best early childhood education possible. We work in partnership with children, their families, our staff, and the community to ensure the goal is met. Before March the 24th, when I made the difficult decision to close my center in order to protect the safety of my children and staff. We were serving 120 children beginning at 6 weeks of age. Since reopening on May the 5th, we have 18 children who have returned. Their parents need us to be safely open as they have nowhere else to go. They know we are taking every possible precaution to keep our program safe for children by cleaning and sanitizing our facility constantly every day. But even this is a challenge for us, as cleaning supplies are difficult to find and expensive once I find them. Yet, many other parents are not comfortable with the idea of sending their children back to childcare and are relying instead on patchwork of grandparents, cousins, and older siblings to keep their children in the home while they return to work. These decisions have us feeling the crunch. I have 10 employees on staff, but I had to lay 4 of them off. Our bills don't go away, which include rent, light bill, gas bill, water bill, phone bill, internet, pest control, van note, insurance on 3 vans that we use to provide before and after care for our families, general liability insurance to protect ourselves, which just took a hike from $5,000 a year to $11,000 a year. Our program did receive 8 weeks of funding from the Paycheck Protection Program, which is gone. And now, with the help of CARES funding, our state is paying for families who receive child care assistance, as 70% of mine do. These funds will continue through the end of September, but once that ends, it's gone. I am just not going to be able to make it. There is still significant gaps in the amount of expenses we have in comparison to the financial support coming in. As every day passes, I grow more and more worried for the future of my program. And I know I am not alone in that fear. As Lucy shared, child care providers across the country are feeling the weight of decades of operating on shoestring budget as part of a system that has been underfunded and under-resourced. If nothing else, I want to make clear that if programs like mine continue closing, this would not only be a loss for individuals like myself who have spent years building up my program, but also for the families we serve who rely on our services, on the children in our community who will miss out on strong start we know high quality early childhood education provide, and for our community that will not be able to recover without us. Please, I urge you to support and save child care programs like mine. On behalf of all of us, I thank you for listening to my story.
Thanks so much, Jennifer. Really compelling. Before we move on to our next panelists, we are going to watch a quick video from the Georgia Department of Early Care and Learning about what they've been doing to support providers and families through the crisis.
I'm Woody Dover with the Georgia Department of Early Care and Learning. I'm the CCDF Co-State Administrator for Georgia, and I would like to share with you how we have utilized funding from the CARES Act to support the child care providers of Georgia and the families they serve during these difficult times. When the public health emergency was declared in March, child care providers were not mandated to close, but their operations were significantly impacted by group size restrictions and extremely low attendance. Our agency's first response was to stabilize public funding for child care programs by allowing providers to receive funding through our child care subsidy program and universal pre-K program at pre-pandemic funding levels. Our agency also implemented a self-reporting system so that child care providers could report whether they had closed temporarily or were open and operating. At the time the CARES Act was signed into law, only 37% of child care providers in Georgia were open, and most were doing so with only a fraction of their normal attendance. The CARES Act resulted in a one-time appropriation of $144 million to the department to support child care in the state. 2 weeks after receiving access to the funds, we opened up an online application to our Stable program to quickly infuse funding support to all licensed child care providers. Stable, or short-term assistance benefit for licensed entities, was rapidly developed and based on our cost modeling data to fund providers based on their cost of maintaining operations, whether they were open or closed, with consideration to public funding amounts received via the Child Care Subsidy and Universal Pre-K programs. $50 million was budgeted for these lump sum payments that would be the equivalent of a single week of costs for all 4,400 licensed child care providers in the state. Ultimately, we received applications totaling $38 million for 3,800 programs, and within 4 weeks of opening the application on May 1st, we had already deposited over $34 million of critical funding into the accounts of child care providers, while having developed the technology to rapidly fund future initiatives to support this critical industry in Georgia. Prior to the pandemic, the child care industry generated economic activity in excess of $4.7 billion for the state annually. As of today, only 55% of licensed providers are open in Georgia, and the Department of Early Care and Learning has spent $54 million of the CARES Act funding received, $38 million for the Stable program, and $16 million for ongoing support of child care providers who provide subsidy care. This week, we began surveying child care providers to determine the best ways to continue to financially support the industry through this crisis in the coming months. Though the funding received has been significant and critical, there is a great deal of uncertainty as to how many child care providers will eventually be able to reopen to serve the needs of families. Current funding will only go so far in trying to support our vital yet financially fragile child care industry, an industry that is essential to the families and the economy of Georgia.
I'm pleased to next introduce Rashid Malik, a senior policy analyst at the Center for American Progress, to discuss their important research on the impact the crisis has had on our childcare supply in this country.
Thank you, Sarah. So glad to be with everyone here and to share our new research that has resulted in an update to our maps at childcaredeserts.org. I'll first highlight the findings in our accompanying report, which you can find at americanprogress.org. It's titled "The Coronavirus Will Make Childcare Deserts Worse and Exacerbate Inequality." A brief explainer about what a childcare desert is. Our definition: a childcare desert is an area where there are 3 times as many young children as there is nearby childcare capacity amongst licensed centers and home-based childcare providers. Now, the decades of underfunding for the childcare system have made these shortages ubiquitous in all states and across all types of neighborhoods. But there are certain areas that are more prone to be childcare deserts and have greater shortages. This can result in parents having to reduce their work hours. One parent, often the mother, stepping out of the labor force, patching together licensed care with unlicensed care that can be of uncertain quality and reliability. And so what we have found in analyzing childcare supply across every neighborhood in the U.S. is that childcare deserts predominantly impact low and middle income neighborhoods. Predominantly Hispanic neighborhoods have some of the lowest supply of nearby childcare. And I would note that 1 in 4 children under the age of 5 is a Hispanic or Latino child. And uniformly, rural communities and small towns have deep shortages of childcare. And without a childcare stabilization funds or relief funds, what we expect is that closures, as we've seen in NAEYC's survey data, which could take out as much as half or more of our childcare supply, would really devastate the market in areas where there was already real shortage of childcare supply. And this is during a period of high uncertainty, record high unemployment, and so what we're seeing on the other side of this is that it's going to make the reopening of the economy smoother in areas with more childcare supply, but those are going to be higher income, upper middle class neighborhoods, and certain areas where there's going to be a lot of uncertainty as the coronavirus flares back up. What we need to be able to ensure that those childcare providers are there for when the rest of our economy is ready to restart. So if we go to the next slide, I just wanted to give a peek at childcaredeserts.org. This is a snapshot of San Jose. You can actually visit childcaredeserts.org, click on the little compass icon at the top of your screen, and search any neighborhood or zip code across the US to see where the communities and the families that are most impacted by childcare deserts are, and where shortages will only be exacerbated by the coming collapse if we don't have the support and relief that we need for the childcare sector. Thank you. I'll pass it back to Sarah.
Wonderful. Thanks, Rashid. Really important work and data. I'd like to now introduce Dr. Alana Yalo, the Chief Academic Officer of KinderCare Education. This crisis is affecting providers, families, children all over the country, all different kinds of sizes and geographies, and I'm really looking forward to hearing your perspective.
Thank you, Sarah, and thank you to everybody who's joining us today. I'm Dr. Alana Yalo, the Chief Academic Officer of KinderCare Education, the nation's largest provider of early education and care. Prior to the COVID pandemic, we provided childcare for nearly 150,000 children from 6 weeks to 12 years of age in 40 states at about 2,000 locations. We employ close to 30,000 teachers, mostly women, with a significant proportion of women of color. Over 1/3 of our children come from low-income families receiving funding through the Child Care and Development Block Grant. We are also the largest provider of off-base care for the military, serving over 5,000 military families. In addition to our KinderCare community centers, our at-work division partners with government agencies and businesses to provide childcare for their employees, and our Champions brand serves nearly 600 school districts to support working families who require care for their children before and or after the traditional school day. I'm also representing the Early Care and Education Consortium today, which is an alliance of the leading multi-state, multi-site childcare providers, representing over 6,000 programs serving nearly 1 million children in 48 states, about 1/3 of which are served through the block grant. And now I'd like to start with the devastating impact of COVID-19 on our children, families, our staff, and the communities we serve. In mid-March, in response to the growing pandemic, we shuttered all of our centers except for those serving essential workers, reducing the number of operating programs to just over 400. Overnight, we had to furlough all but around 7,000 of our 30,000 employees. Our enrollment dropped from approximately 130,000 children to 13,000 children, and stabilized at about 20,000 children per week until states began to reopen, operating at significant losses due to reduced enrollments and dramatically increased costs. Following best practice guidance from the Centers for Disease Control and the American Academy of Pediatrics, and working with emergency preparedness physicians, we invested heavily in developing new safety protocols, including social distancing, health checks, enhanced cleaning, staff training. We assigned additional staff to every open center. We limited enrollment in group sizes, and we kept children and staff in consistent groups. Over the past 2 months, we have been able to open substantially all of our centers, but our operations are not sustainable as we continue to operate many programs at considerable losses based on approximately a 30 to 35% increase in operating costs for staffing, supplies, and cleaning, while it significantly reduced capacity and revenues, serving only approximately half of the number of children we served just 4 months ago. Our increased costs for PP&E and cleaning are approximately $400 to $500 per center per week. We have deferred expenses in 2020, such as rent and taxes, that will come due in 2021. And we find ourselves, like the rest of the nation, in a state of constant uncertainty as to where the next resurgence will be, threatening our ability to serve our families and protect our staff, despite transmission rates in our centers that are substantially below those in almost all of the communities we serve. So where are we today? Simply put, the Child Care Center, which has a total of 1.5 million employees and contributes $100 billion to the economy, is in crisis. Less than 25% of the child care market received a PPP, and most did not receive a loan from the Treasury Loan Facility. Absent assistance, it is estimated, as you've heard, that approximately 50% of the country's child care centers are likely to close permanently, leading to a loss of 4.5 million child care slots. Even before the pandemic, access to care was a major barrier for working families, which will be further exacerbated if child care programs are forced to close. And as the child care industry is threatened, so is our nation's path to a full economic recovery. We absolutely need your help. We ask that Congress include short-term financial assistance for child care providers in the next stimulus package. If high-quality licensed childcare closes because of financial issues, 17.5 million workers across a broad socioeconomic spectrum, about 20% of the American workforce, will be left without care. And if the high-quality providers that follow strict health and safety guidelines do not survive, desperate parents may be forced to seek alternative arrangements for their children, which may not be as safe. We need Congress to fund a child care stabilization fund that will give providers access to grants to help them address lower enrollment and significantly higher operational costs during this critical transition period. And this is clearly a bipartisan issue. In addition, families need help as well. We are asking for support for working families to help pay for their child care, many of whom have lost jobs, been furloughed, or taken pay cuts as a result of the pandemic. This is why increasing the Child and Development Care Tax Credit and the DCAP FSA contribution limits, as well as increasing funding for the Child Care and Development Block Grant, are also important. In closing, I would like to thank you for the opportunity to speak on behalf of KinderCare, the Early Care and Education Consortium, and the millions of children under 5 years of age who cannot speak for themselves. Their families who depend on high-quality childcare to return to work, knowing that their children are safe and secure, and the dedicated teachers and center administrators who have truly shown themselves to be the essential backbone of our nation during this pandemic. Thank you so much for your time and support.
And thank you, Alana. And to bring a little parent perspective into this, I'm pleased to share a video featuring Deja Reed, a single mom in New Orleans, Louisiana, with her 22-month-old baby.
So my name is Deja Reed. I have one son. His name is Jared McKnight. He is currently 22 months. I am a single mother at this time, so things can be a little challenging, I want to say, as far as finances. I currently work for the city of New Orleans. I've been there for almost 4 years. During the whole pandemic with COVID-19, my son's daycare closed. The kids were out of school starting on March the 15th. My job didn't close until I think it was later on in the beginning of April. When his daycare initially closed with the school guidelines and everything, I had to stay home with him. There was no provider or anything, available for him to go to daycare, and I did have to unfortunately be out of work. They did call me back to work in the summer camp in one of the summer camp positions, but unfortunately my son's daycare closed permanently. They were shut down. They were not able to open back up due to funding and, the monies that they had lost during COVID-19, during the months that they didn't have any funding. They did close down for those 2 months, I was not able to go back to work, with everybody else back in June. Even though it would have been another position, it would have been something that could help me tremendously because they cut down our pay to 2/3 of our income. Just to go back and have a position available, that would have been, a tremendous help. But again, they shut down and they didn't even have the funding to open back up. I looked for daycares, several daycares in the area, and unfortunately, by the limit of people that was allowed in the classrooms and in the daycares, with the new COVID-19 guidelines, it was slim to zero. So it was hard for me to find something that was suitable for my son and I, and then they didn't have many open. They didn't have none available. So that was very challenging. I'm still, unfortunately, out of work because I haven't been able to find a daycare. I haven't been able to find anything for my son right now at this time. I have to make things work. So what I want Congress to know is people like me don't have all the money, but I am on a route to try to make my life better, try to have a career, to try to, make a better life for me and my son. Just having that help before I get there would be nice, just to have that support from, a good daycare to bring my son where I can have a peace of mind to leave my son, knowing that he's in good hands, knowing that, he's getting development like he needs. And it's not just, he's sitting there all day or he's crying or he's fussing because he's not getting the attention that he needs. Nothing I wouldn't do to have my child, at an affordable daycare or a daycare with good quality or a daycare where I know that he's being well taken care of.
Unbelievable. Really grateful to have the ability to have shared that, and to our partners who work with Deja and all the parents. I'd now like to turn it over to our friend Julia Barfield of the U.S. Chamber of Commerce Foundation, who will talk a little bit about how what getting back to work means, and the essential role of childcare in that regard.
Thank you so much, Sarah, and thank you for everyone for joining today. To be honest, that was a hard video to follow. I feel like I'm processing a little bit of what Ms. Reed said, because these are stories that we've heard from millions of parents, and I think so many of you who are participating today, either as speakers, parents themselves, or who are listening in, know that the reality of juggling your work and childcare feels like a losing battle so often. And I think the pandemic has really shed light on this issue that we also care about deeply. So I went a little off script there, but for quick background, I work for the U.S. Chamber of Commerce Foundation. We are the nonprofit branch of the U.S. Chamber, and our whole goal is to educate and mobilize the business community to address the childcare needs of their working parents. So you'll hear from a great partner of ours shortly, Scott Hall from the Greater KC Chamber, who is really committed to this. But the joy that I have every day is working with businesses who are committed to this issue and trying to get more business champions to join in. So I'm going to give you a very quick overview of our work to date, and then share some new data that's coming in the next several weeks that I'm really thrilled about. So prior to the pandemic, we released a series of reports called Untapped Potential. These were 4 state reports that looked at, work from home life. 4 state reports that looked at the economic impact of childcare breakdowns. Looked at the economic impact of childcare breakdowns in 4 states. And actually, Ms. Calvert, who spoke earlier, was featured in one of our videos. And so if you want to see her great program firsthand, we've got a video on her and some of her employees. So before the pandemic, we found that, for example, in Pennsylvania, they were losing $3.47 billion annually due to breakdowns in childcare. Now, as a reminder, that's $3.47 billion annually when the economy is strong and unemployment is low. And so now that COVID has wreaked havoc on everything that we knew, it has really exacerbated the problem. We're also finding that families, similar to Ms. Reed, who just spoke, are cobbling together care. And we're calling this the child care equation, because any working parent knows that you probably don't have just one provider who's meeting all of your childcare needs, but really cobbling together care with extended hour care or after school care, or multiple care providers from friends and families, in addition to paid out of home work. And so what we found recently in our new surveys is that as a result of COVID wreaking havoc on these equations that parents are coming up with, is 1 in 5 parents are unsure if they're going to return to their pre-COVID work situation. So that means either going from full-time to part-time, that means going fully remote, or it means changing your employer altogether. And from our perspective, that obviously has economic impacts on families, and it ultimately impacts employers. We also have new research coming out on employer perspectives, and we have found that 40% of employers are saying that childcare is a huge concern of theirs, in that they're worried it will mean that parents won't come back to work. So they're factoring it into their return to work plans, but ultimately they're not quite sure what to do. So really from our perspective, we want to see the childcare supply, like we saw from Ms. Calver earlier, providers who are incredibly skilled, passionate about their jobs, and really good at what they do. We want to see them stay in business. And in order for them to stay in business, we can all go back to work. But without intervention of some kind, we won't be able to see our economy recover in the way that we all need it to. So now I'll turn it over to our next speaker.
Thanks so much, Julia. And to amplify that, as she said, we're joined by Scott Hall, Senior Vice President of the Greater Kansas City Chamber of Commerce. Scott.
Good afternoon, everybody. It's a pleasure to be with you. Julia, that was great, really interesting. And as Julia referenced, she and I work together. The U.S. Chamber Foundation is a tremendous leader across the country. The issue of really childhood education, really childcare and education too. Full disclosure, everyone you've heard from so far is an expert in childcare, and I am not. I'm a Chamber of Commerce guy. And you may be asking yourself, why is a Chamber of Commerce guy speaking to us about childcare? And it's quite simply because our mission at the KC Chamber is to lead the way to the best KC region, and we cannot do that without adequate, abundant, and affordable childcare. If you take anything away from my remarks, it should be this, and I will offer attribution if I can ever remember who I first heard say this, but childcare is the grease that allows the gears of American business to move. Without it, we will not recover. So we partnered in a study here locally, the KC Chamber, with some of our early learning partners. And we asked respondents throughout the community about their childcare needs in light of COVID-19. 32% of those respondents, these are folks in the workforce, said they have a childcare need that needs to be met before they can return to the workplace. Of those 30%, half saw their childcare centers temporarily closed due to COVID. 15% saw their childcare centers permanently closed due to COVID. And 42% have been working from home or furloughed and will need different childcare arrangements upon their return to the workplace. And when you look at the age breakdown of the children, as these people are reporting, it's the youngest kids that are causing the greatest strain on business. Young children, infants, preschool-aged kids, and elementary school-aged kids. You can tell from my background that I have some personal experience with some of these things. More than 50% of the respondents to our survey said they needed center-based childcare options rather than in-home or family care. And I think it's really important as we think about how we recover and how we recover using the support of childcare, that family care for many employees, for businesses in your respective districts is different, because grandparents and older adults who typically make up a large portion of that family care workforce are not able to care for children in COVID the same way they were before, because they're especially at risk to catching, and then if they do catch, having a terrible case of the disease itself. I also think it's very interesting and worth noting to you all that as we conducted our survey, we know that lower income individuals are especially susceptible and in need of childcare assistance, but the challenge of childcare is not exclusive to any single socioeconomic demographic. only 25% of the respondents to our survey indicated that they needed any kind of financial support with their childcare. It's not just that people need money to help with their childcare, they need childcare centers open that they can bring their children to. We also conducted a poll of our own membership. We surveyed our members about their concerns related to COVID. The single highest concern related to COVID, as you would probably expect, was personal health and health of employees. Second, following closely and safely distanced from any other concern expressed by our membership, was the need around childcare. So I'll close with just a few thoughts for you all. To bring workers back to the workplace, a substantial portion of the workforce will need to be able to find reliable childcare. And as you've heard today, that is not in abundance right now. Options need to be made available from different types, but especially center-based care that is accessible throughout a community like Kansas City is essential to the return to the workplace. And any help you all can give to these centers to ensure that they're able to open and remain open will be essential to the economic recovery of your respective districts. I would analogize it to this. If the tabletop is the American economy, childcare is one of the legs that has to be securely affixed to that tabletop in order for it to stand up. So if the question is, what will childcare mean for the recovery, for our country's economic recovery? I think the very obvious and simple answer is there is no economic recovery without abundant, affordable childcare. Thank you all for your time. I'll turn it back over to our moderator.
Thank you, Scott. We appreciate it. Before we turn to our congressional friends, we are going to see a quick video from Robin Phillips, the CEO of Child Care Aware of Missouri, to talk about Child Care Missouri right now.
Hello, my name is Robin Phillips. I'm the Chief Executive Officer of Child Care Aware of Missouri, the state managing network for child care resource and referral. I'm truly losing sleep every night over the concern of what's happening to the child care infrastructure in Missouri, which is likely happening across the country. And that is, it's truly on the ledge, right on the edge of teetering off into a full crumble. And there's absolutely no way our economies in any state are going to recover without childcare. You know, currently in Missouri, we have about 3,300 childcare programs. I'm not counting summer camps. I'm not counting exempt childcare preschools in the school systems. All that's closed. But approximately 3,300 programs across the state of Missouri. And during COVID, right at the end of March, I mean, truly overnight, about half of that capacity shut down. So where we sit right now is, of those 3,300 programs, about 2,200 of them are in operation, so it's about 65%. But don't let that number fool you, because everyone's operating at reduced capacity because of social distancing and increased staff because of social distancing. So that in itself has a direct impact on revenue and expenses. When I said earlier about staying awake, literally losing sleep, it's because there have not been enough mechanisms over 40 years, but COVID's pulled back the curtain on everything that's been lacking in this underfunded, underappreciated system. In that, we relied on these childcare educators to be an essential workforce, to be on the front lines, to care for children of essential workers and medical personnel and nurses and law enforcement, yet they were given nothing to support increased costs for cleaning, increased staff, loss of revenue for serving a smaller number of children. And I mean, I could go on and on. What's frustrating is that the stabilization that everybody's talking about, and there's simply not enough money in the Child Care Development Fund to support stabilizing. Now, Missouri has made some adjustments and did receive a portion of the CARES Act emergency funding. So of the $3.5 billion, Missouri received almost $65 million. But truly, the ask is $50 billion. $3.5 billion is 7%. It's merely a down payment on a critical infrastructure that if we don't have it and it's not safe and it's not healthy and it's not of quality, I guarantee you we're going to be having very different conversations in 4 to 6 months. And that's going to be loss of businesses. Childcare businesses are businesses. We're going to be talking about increased stress on those business owners, those childcare educators, their staff. Most importantly, the increased stress and trauma on children, our future workforce, and what they're being faced with under these stressful times and at home and wherever they may be spending a good portion of their waking hours in those first 2,000 days of their life.
You know, we covered a lot of ground today. We touched on a lot of different pieces of this really intricate issue that we're facing right now. If you have questions, I encourage you to submit them to contact@childcarerelief.org, and we'll make sure that we grapple with those and get responses out. We also have a number of other great resources and important reports and data out of many partners who we couldn't get on the screen today, which we will follow up with all of those after we wrap up on the video portion, and we'll make sure that everyone has all the information they need going forward. But mostly appreciate everyone taking time out of their day to learn more and really walk away with at least what you need at the outset for why it's so critical that we stabilize this really important industry, because we all heard it today, childcare is truly essential. So thank you all.